good evening, aspirants. Hope you all are doing good. Welcome to Eternal Nursing Education. Hope आप लोग सब स्वस्थ होंगे, मस्त होंगे, अपनी पढ़ाई में व्यस्त होंगे. Okay. So yesterday we were completing with our last class. Actually, what we had done is our infection control we are studying, right? So हम लोगों ने क्या क्या देखा था? Let's recap in a nutshell. Okay. So first of all, we studied that what is basically infection and what are the clinical features which can be visible in case of a person who is having infection. I have told you those three key features. Okay, that is your redness, swelling, and warmth. Along with that, other features were also there. Okay. Then after that, what we are the other things which we studied, that is what our basic causes can be there, and the most important thing, that is we underwent what are the classic classifications or clinical types of your infection. That is none other than our primary infection, as I told you. Okay, secondary infection, yes, then reinfection, yes, after that, then followed by your other types of infection, that is your iatrogenic infection, and most important, that is your hospital care associated infection, that is HCAI, also known as your nosocomial infections. Okay, am I clear till this? और nosocomial infections में हम लोगों ने basically we also studied that it is nosocomial infection is basically device related also. How that device related, let it be considering of that COTI. Okay, that is your catheter associated urinary tract infections. Then CLABSI, that is your central line associated bloodstream infections. Okay, after that VAP, that is your ventilator associated pneumonia. We had discussed all the three things. Okay, and we also studied that how this can happen and what is the instance. Basically everything we studied in details. Okay, so I hope the yesterday's class was very comfortable for you and smooth going for all of you all. So today we'll be continuing with the next part of the chapter. That is, today we'll be studying what is the basic strategies and steps of infection. Means what are the stages an infection underwent throughout it causes the inflammation in your body. And after that we'll be also studying that how is the chain of the cycle is going on and on. We'll study it in details. Along with that हम लोग और भी study करेंगे कि कैसे आप infection protocols that can be managed. Okay, what are the different infection control measures that can be taken to manage the further situations. Okay, am I clear? So let's start with it. Okay. Okay. So see. Okay. So first we'll be understanding today that what are the stages of infection. Okay. Listen, note my words that this is the very important part. Okay, this is a very important part because question arises from many parts of this stages of infection. Okay, so you need to understand each and every stage. There are basically some stages that what each stage carries some specificity, some importance is there of each stage. Okay, so we need to understand and we'll go details. Okay, and any doubt you're having, so mention your doubts in your comment section and I'll be free for you all to clear all your doubts. And don't forget to share, subscribe, and like our channel because your like gives us the motivation to provide you more informational contents. Okay. So see. So basically the stage of infection. First starts with your incubation period. Okay. The stage 1 is incubation period. What is incubation period? What do you understand by the term incubation period? मतलब इसमें होता क्या है? ठीक है. पहला स्टेज ये है स्टेज 1. Okay, so this is your stage 1 is your incubation period. So what happens now in this, आप ये जो ड्यूरेशन है, ठीक है, ये जो है ये फर्स्ट स्टेज है. क्या होता है इसमें, जो भी आपके इन्फेक्शन कॉजिंग एजेंट्स, द पैथोजेंस, द माइक्रोऑर्गेनिजम्स, okay, or the bacteria or the virus or the fungi, whatever it may be, it is taking entry into your body. Okay, वो आपकी बॉडी में एंट्री ले लेता है. ओके, आफ्टर दैट व्हाट हैपेंस, उस टाइम से लेकर ड्यूरिंग दैट टाइम, उस टाइम से लेकर टिल द अपीयरेंस ऑफ द फर्स्ट साइन एंड सिम्टम ऑफ योर बॉडी, दैट ड्यूरेशन इज कॉल्ड एज एन इंक्यूबेशन पीरियड. Okay, so incubation period means what? The duration between the entry of pathogen into your body till the appearance of the first sign and symptoms in your body. That duration is called as your incubation period. Every disease condition, noted, okay, that every disease condition has got a separate and a specific incubation period. Okay, am I clear till this? Yes, हर disease condition का अपना specific और peculiar incubation period रहता है. Okay, every disease condition has their got different incubation period depending on the severity. Yes, कितना severe वो है, how much the severity it is, how much pathogenicity it is carrying in itself, depending on that. So we need to understand कि basically incubation period is the period that is the duration between entry of pathogen. Okay, the duration between entry of pathogen till what? Till appearance of first sign and symptoms. Am I clear for you all? Okay, तो आपका इंक्यूबेशन पीरियड क्या है? इंक्यूबेशन पीरियड माने ओके, इट इज द पीरियड जिसमें कि आपका जो पैथोजन है वो एंट्री ले लेता है और टिल द अपीयरेंस ऑफ द फर्स्ट साइन एंड सिम्टम इट इज कॉल्ड एज योर स्टेज 1, दैट इज योर incubation period. Okay, am I clear till this? Yes, can we move to the next stage? Yes, then comes to stage 2. Okay, this stage says what? This is prodromal period. Okay, so prodromal period, what happens in this? इसमें क्या होता है ना, देखो फर्स्ट स्टेज में व्हाट हैपेंस, इट इज लाइक अ साइकिल. यू नीड टू अंडरस्टैंड. फर्स्ट आप अगर इफ यू आर गेटिंग इन्फेक्टेड, सो फॉर दैट द मेन रिक्वायरमेंट इज द पैथोजन विल हैव टू टेक एंट्री इनटू योर बॉडी, जो कि हो चुका है इन योर इंक्यूबेशन पीरियड. ओके, then once it is entering means it will start producing its effects. So its effect is first sign and symptoms. That has already happened in an incubation period. Okay, that has also happened. So stage 2, this is a prodromal period. Prodromal period means it is the period in between the non-specific symptoms to the specific symptoms of your body. Means see, जैसे कि मैंने एक एग्जाम्पल नहीं दिया आपको, जस्ट लिसन टू मी. इंक्यूबेशन पीरियड है, ठीक है. इंक्यूबेशन पीरियड में फॉर एग्जाम्पल आप ले सकते हो जैसे कि चिकन पॉक्स. ओके, चिकन पॉक्स हैज गॉट 2 to 3 weeks ऑफ इंक्यूबेशन पीरियड. और इन्फ्लुएंजा, ओके, इन्फ्लुएंजा में भी इन्फ्लुएंजा टेक्स 72 hours, 1 to 3 days. ओके, सो इन्फ्लुएंजा का जो इंक्यूबेशन पीरियड है दैट इज बेसिकली 1 to 3 days. दैट मीन्स जो इन्फ्लुएंजा वायरस है, ओके, वो आपकी बॉडी में एंट्री लेने तक से लेकर till the appearance of your first sign and symptoms, that probably takes around 72 hours. So in 72 hours or in 3 days, the virus enters into your body, produces its harmful effects that is seen in you, that is your sneezing, coughing, headache, fever, whatever. Okay, this is the incubation period. Means how much time it is taking to produce its effect and how much time it is taking to take entry into your body. That duration in between that is called as the incubation period. Okay, am I clear till this? Yes, with the example also we studied. Next is a prodromal period. So for example, we'll take influenza only. Okay, so influenza has taken entry into your body, first sign and symptom has also occurred. That first sign and symptom is a general specific symptom. वो general specific symptom है. मतलब general जैसे कि like your fever हर disease condition में is there. It is quite common. Okay, so हर disease condition में fever is seen. Fever. Okay, then malaise. Malaise means fatigue. Okay, then headache. These are the non-specific sign and symptoms. These are the non-specific means जो disease जो symptoms, basically it does not tells you about the specificity of the disease. Fever can be due to any reason. We cannot understand that fever is due to, see, if you're getting any inflammation or infection, you are getting fever. If you have got post-surgical, if you're in your post-surgical period, then also fever. If you are during your ovulation period, then also your body temperature rises. Okay, or if you are having any typhoid or jaundice, etc., that is also is accompanied with fever. So fever is such a symptom, it's a non-specific. Okay, as I told you last class also, fever is not a symptom basically, but we talk about it in the clinical features. So fever is such a clinical feature, it is a sign. Okay, that means it is a non-specific clinical feature, means you cannot exactly tell that if a person is having fever, you cannot tell that person is having infection. It might be due to any conditions. If the person has got any other abdominal infections or hepatitis A also, or food poisoning thing, fever is accompanied by it. Okay, so the fever along with your malaise, fatigue, headache, these all are your non-specific symptoms. These all are your non-specific symptoms. So prodromal period is the period in between the appearance of non-specific symptoms to specific sign and symptom. This is the main thing. आई बात समझ में? ठीक है, तो प्रोड्रोमल पीरियड में क्या हो रहा है ना, जो भी आपकी नॉन स्पेसिफिक साइन एंड सिम्टम्स विच यू हैड सीन इन द incubation period, ये सारे non specific symptoms are getting converted into specific sign and symptoms, means you will be able to see specific sign and symptoms in this period. Like for example, हमने इन्फ्लुएंजा को एग्जाम्पल लिया हुआ है, तो इंक्यूबेशन पीरियड कितना है इन्फ्लुएंजा का, 1 से 3 days. Okay, so that is the incubation period, means it is the duration between the entry of pathogen to appearance of first sign and symptom. वो साइन सिम्टम्स कौन से वाले हैं, वो सारे नॉन स्पेसिफिक साइन एंड सिम्टम्स है। मीन्स अभी तक आप इंक्यूबेशन पीरियड में ये नहीं अंदाजा लगा सकते हो दैट द पर्सन, यू कैन नॉट अंडरस्टैंड अबाउट द प्रोबेबिलिटी दैट द पर्सन इज हैविंग इन्फ्लुएंजा ओनली, इट माइट बी एनीथिंग. ओके, सो बट इट इज गेटिंग क्लियर्ड इन द प्रोड्रोमल पीरियड दैट जब जो वो नॉन स्पेसिफिक सिम्टम्स व्हेन दे आर गेटिंग कन्वर्टेड इनटू द स्पेसिफिक फीचर्स, then you will be able to understand, oh, this specific features is found in this disease condition. So in prodromal period, you will be able to diagnose or you will be able to understand that what kind of disease condition you are having right now. Okay, so specific symptoms means like influenza की क्या specific symptoms हो सकते हैं, like sore throat, yes, and hoarseness of voice, running nose, okay, sneezing, etc. Yes, so these are the specific features of what disease condition? Influenza. So this is the prodromal period for influenza. Means the appearance of the specific symptoms being converted from non-specific. Means धीरे धीरे non-specific symptoms से वो it is getting converted to specific features. Means now you are able to understand, this is the specific symptoms. That means she's having that disease. But this means the pathogen is multiplying rapidly in your body. That is why it is able to produce specific features. And your body is unable to fight with that or counter with that pathogen. This means that. Okay. So stage 2 says you all about that it is the prodromal period. Prodromal means the appearance of the non-specific symptoms to till the appearance of more specific features, which tells you clearly about the disease condition. Okay, this is your prodromal period. I hope this is clear till now for this for all of you. Okay, then we'll be moving on to the next stage. Stage 1 incubation period, stage 2 prodromal period. Okay, now we'll be understanding the stage 3. Okay, stage 3 is the stage of illness. It is the stage of, okay, so what it tells you about the stage of illness means, what you understand by the stage means this is the stage in which the person is at its peak of infection. पर्सन को पहले इंक्यूबेशन पीरियड होता है जिसमें द एंट्री ऑफ पैथोजन हैज टेकन प्लेस along with that first general specific sign and symptom has taken place. Then the person undergoes the next stage, that is the prodromal period, in which the person sees from the conversion of the non-specific sign and symptoms to the till the appearance of the specific sign and features that tells him about the particular disease condition. Okay, now now the pathogen is multiplying rapidly and getting spread in the body rapidly, due to which the person is now in the stage of illness. That means the disease condition is at its peak. The person is contagious at this stage. This is a question. This is the state of contagious state, means the person is at its stage from which it can spread the infection to further person. This is a question, that in which stage the person can be considered as contagious, that is a stage of illness. Along with that आपका जो in prodromal period also the person is declared as contagious. Okay, you need to note this. Okay, it can also be a question. Okay. So in the prodromal period also the person is contagious, because at that time also the person is getting clinical specific clinical features. That means the person is getting infected and the person is contagious. It can be contagious. Okay. So your prodromal period and the stage of illness, these two are the particular stages at which the person is at such a state from which it can spread the infection to further persons. Okay, क्रॉस इन्फेक्शंस की बहुत सारे चांसेस है यहाँ पे. So stage of illness is the, that means the person is at its peak to spread the disease. Okay, and all the clinical features are very specific, clearly telling you about what the person is going through, what is the disease condition the person is having right now. Okay, am I clear? So that means it is the stage of, that means it is the stage of infection, stage of contagious. ठीक है, ये आपका contagious state में है. And the person is at its peak of infection. The person is at the peak of infection. Yes, where the pathogen is at its much higher strength. Pathogen is at strength. क्रॉस इन्फेक्शन के भी बहुत सारे चांसेस हैं यहाँ पे. So this is the stage of illness. Okay, so from this is important. Okay, this is the contagious state, the person at its peak of infection and the pathogen is at its strength. Yes, am I clear till this? So stage 1 is your incubation period, stage 2 is a prodromal period, followed by stage 3. Stage 3 is the stage of illness. Okay, then next comes the और हाँ, one more thing, we were discussing about हम लोगों ने कौन सा एग्जाम्पल शुरू से लिया हुआ है, that is your influenza. Means in this stage, okay, in this stage the person is having the highest rate of the virus among its body. Okay, that means the person is having all the specific sign and symptoms of influenza in him. Okay, means hoarseness, fever, running nose. Okay, then okay, many the things are there. Okay, और उसके बाद भी आपका जो sore throat is there, hoarseness is there. Okay, then voice changes, vocal cord problems is there. Okay, then difficulty in swallowing, all the clinical features of influenza that is being seen in this period. This is the highest trend when the graph of the disease is much higher. Okay, the symptoms vary and it's at its higher range. Okay, then comes the stage 4. That is stage of convalescence. Stage of convalescence means what happens in this stage? In this stage, now the person has taken medications. Okay, since the person has got understood that I am having influenza, so I'll take certain medications. The person may take some and means antiviral medications or antibiotics, or depending on the condition, the person is taking certain medications like Montelukast or cetirizine, anything the person is taking, or anti-allergic medications if the person is taking to recover himself. Okay, so since the person is taking medications, so the symptoms will start to subside. Means धीरे धीरे symptoms reduce होने लगते हैं. That means the disease condition is getting reduced in the body, the infection stage is getting reduced in the person's body. Okay, so what happens in this, the symptoms start to subside or reduced, okay, in the person's body. So stage of convalescence means in this stage, okay, the stage of convalescence means in this stage what happens? The symptoms start, the जो भी clinical features थे, okay, whatever the sign and symptoms it was there, okay, so it's all getting reduced and all the symptoms starts to decrease, means the person is starting to recover. Okay, person is starting to recover, starting to recover, not fully recover, but its beginning recovery has started. Okay, this is the stage of convalescence. You need to understand symptoms starts to reduce in the person's body, infection is getting reduced and the person is starting to recover. Yes, this is stage 4. Now comes the last stage, that is your stage 5, that is the stage of recovery, that it is the recovery period or stage of recovery, anything you can say. That means the person is now fully recovered, the person is now fully recovered. Clear? Till this it is clear. So means all the symptoms have gone, the person is now recovered. Okay, the person is no more infected right now, he cannot spread infection right now, he is no more contagious right now. So these are the 5 stages which we need to understand. See, आपका एक graph भी है which I'll be showing you in this. See, first is your, while I'm writing with this, okay, so first is your incubation period. Yes, stage 1, followed by stage 2, prodromal period, followed by stage of illness or stage of highest infection, stage 3, then stage 4. Okay, sorry. Okay, convalescent stage. Okay, this is stage 4. Okay, now it's the stage of recovery. Okay, so basically, these are the 5 stages of your infection. Okay, this is the 5 stages of infection. ठीक है? लेकिन one more thing is that from here, okay, the symptom starts to increase, then it decreases in this state. Okay, that means the symptom starts to increase from the prodromal period. Okay, ठीक है? That means what happens is that, okay, that means the symptom starts to increase from the prodromal period, okay, at its peak. In the stage of illness, the symptoms is at its peak. Okay, then after it is getting reduced in the convalescent state, then it's the recovery. Okay, basically this is the graph. Am I clear? ठीक है? That means, just give a second to me. See, if I'll be telling you in a easier way, just see. That means the graph is like this, like this. Okay, this is the stage of your infection, illness, stage of illness, that is your stage 3. Yes, it starts to subside. That means this is the stage, this is the convalescent stage. Yes, ठीक है? This is the recovery stage. Yes, then it starts to increase, means this is the prodromal. It is increasing like this, no? It has its peak, then it starts to decrease. Okay, this is prodromal period and this is the starting, that is your incubation period. Am I clear for you all till now? Yes. So these are the various stages, okay, which happen. This is the stage 5. This is the stage 4. Yes, this is the stage 2. And this is the stage 1. Okay. So this is the graph or your stage of infection representing all the stages, and the graph is at its peak in stage of illness. Means all the specific signs and symptoms are clear in this, and the person is clearly contagious in this state. Okay. Am I clear? So these are all the 5 stages of infection. If you will be asked that what are the basic 5 stages of infection, you can say that first is incubation period, second is the prodromal period, third stage is the stage of illness, fourth is the stage of convalescence, and fifth is the stage of recovery. Yes. Okay. Till now is it clear? Now we'll understand. Okay, यहाँ तक अगर हम आ चुके हैं, so we'll understand that how this infection is spreading. We understood that what are its stages, how it is causing disease conditions, then what, in which stage it does what. Okay, we understood. But how this infection is getting transferred from one person to another, how the cycle is going on, we'll understand that. For that, we need to understand the chain of infection. We need to understand the chain of infection. Okay, so there is a chain. Okay, so we'll understand that cycle, that how the infection is getting spread and what persons it is getting affected more, and how it's finding its way from one person to another. Okay, yes, let's see. First, अगर आपको infection होना है, so first what is needed for the first series? Okay, we're understanding the cycle. So for first, what we need to get, we need to have an infectious agent. Okay, we need to have an infectious agent that will cause the disease. Infection होने के लिए भी तो कोई agent चाहिए ना, pathogen. Okay, any bacteria or any virus or any fungal infection, anything. Yes, so first is your infectious agent. I'm changing my ink. Okay. Okay, first is the infectious agent. Yes, first है infectious agent. The agent has come who is gonna spread the infection. Yes, for example, influenza virus only. Influenza virus is the infectious agent that is gonna cause the disease. ठीक है? So for the first cycle, we got our first person, that is infectious stage. Then what this agent, what it will do? It will, उसको क्या चाहिए? इन्फेक्शन कॉज करने के लिए दैट पर्सन नीड्स अ बॉडी. Okay, it needs a host's body which will act as a reservoir. Okay, so the person wants, so that person, sorry, the infectious agent wants a reservoir. Okay, so this is the part 2 of the cycle. This is the stage 2 of the cycle. In the cycle of spreading infection, the first part is played by the infection agent. We need an infectious agent which will cause infection. Then that agent needs a reservoir. उसको एक होम चाहिए, एक शेल्टर, जिसमें वो मल्टीप्लाई करेगा, डिविजन होगा, different it will spread its roots, it will cause signs and symptoms, it will make the person ill. So it needed a reservoir. So human body acts as a reservoir for the infectious agent. Okay, so second stage is reservoir. Okay, so now it has entered in our body. It got our body served as a reservoir for the agent. Then it made us ill. उसने हमें ill कर दिया. It, for example, influenza virus only. The virus has entered our body. Our body provided as a reservoir to the agent. We became ill. We have taken medications. Now we are getting recovered. So now the agent has to find its way out from our body. अब नहीं रहना है. Now I had made this person ill. Okay, now I have to find a new way out. New person चाहिए, new reservoir चाहिए. So that's why the agent will find its way out so that it can get out of our body. So next is the portal of exit. Okay, so the agent will now search to get exit from our body. It will try to get out of our body. Okay, for example, in when we are having influenza, what happens to that? Sometimes we get sputum. Okay, sometimes we are getting a running nose, all those discharge, through that the virus is getting out of our body, so it will find its way out of our body. Okay, by this that is a portal of exit. Okay, for example, those who are having any amoebic infections also, that time, what happens through their stool. Okay, that amoeba is getting discharged out of the body. Okay, the children are getting, means the worms, the one infestation जो होते हैं छोटे बच्चों में. See what happens, no, in that stool only you will be able to see all those infestations moving in the stool. That's why they are taking albendazole. Okay, so it has caused infection, now it wants to get out of your body, so that is the portal of exit. That is the third part. The third part of your chain is portal of exit. Now it will want to move transmission. Now it will see, now I had made this person ill. Okay, now I have to search for another mode of transmission to find a new host. A new host पाने के लिए the infectious agent needs a mode of transmission, how it will move from one person to another. Suppose for example I am infected, one person is sitting in front of me. ठीक है, मान लो आप मेरे सामने बैठे हो. ठीक है, I'll sneeze. I'll not put any handkerchief or hand in front of my mouth. I'll just simply sneeze on you. Okay, that is very bad. Okay, that should not be done. But I'm telling you. Okay, just a thing. Okay, no, I just sneezed. Okay, so that air, it served as a mode of transmission for the agent. It will move from me to you through the air. Okay, or through any droplet infections. Yes, so that is the mode of transmission. Yes. Next is your mode of transmission. Okay, then mode of transmission मिल गया. ठीक है, now if so since the agent has got the mode of transmission, now it will see how will I enter to this person's body. I have got my mode, the air or the water, contaminated water or droplet, it serves as the mode. फॉर एग्जाम्पल द पर्सन, आप जो मेरे सामने बैठे हो, अगर आपने मास्क पहन रखा है, सो दिस एजेंट विल नॉट गेट एंट्री इनटू योर बॉडी, वो घुस नहीं पाएगा. लेकिन फॉर एग्जाम्पल यू हैव नॉट टेकन प्रिकॉशंस, यू हैव नॉट वेयर मास्क, ओके, यू हैव नॉट वोर अ मास्क और यू हैव नॉट हेल्ड अ हैंकरशिप, सो through your nasal tract or through your mouth, okay, through your nose and through your mouth, the infectious agent will get its entry. So now it is the portal of entry. Okay, this is the fifth part. So mode of transmission, yes, mode of transmission is the fourth part. Okay, mode of transmission is the fourth part, and your portal of entry is the fifth part. Okay, so portal of entry, उसको entry मिल गया आपके body में. Yes, now you are the new host for the patient, means for the infectious agent. Or if and who becomes the host, basically those who are immunocompromised specifically. अगर आपकी body में immunity, if it is properly there, that means it won't be able to cause specific infections in you. Okay, but if you are immunocompromised, if your immunity is reduced, that means you are the new susceptible host for the agent. Susceptible host means the host who is weak and who will be serving as a new reservoir for the infectious agent. So the next part is susceptible host, and this cycle will go on and on and on. So susceptible host is your sixth. ठीक है, so this is the chain of infection. This is the chain. So this is the total chain of infection. First chain, first is your infectious agent. We need an agent to cause infection. Then that infectious agent needs a reservoir. Okay, that will provide as a shelter to the agent. Yes, that is the second part. Third means it has made you ill, it has done its work, it has multiplied in your body. Okay, you have taken medication, now you're recovering. So the infectious agent will now find its way out of your body. That is the third part, is a portal of exit. The agent will take exit from your body. It will go. Okay. After that, after taking exit, okay, now it requires a mode to transfer in the air, either in the air, in the water, through contaminated food, or in the food handling methods, if it is, if you're not taking proper hand hygiene. That means mode of transmission is the fourth part. Okay, after that it will require new host, so it will try to enter if the host is not taking proper precautions. That means it will find its way out for the portal of entry into your body. And if you are immunocompromised, so now you become the susceptible host for the agent. Susceptible host means the person who is immunocompromised. Okay. Am I clear till this? Am I clear till this? Okay. So this is a total chain having 6 components. Question may ask you like this: which is the third part of the chain of infection? So you have to answer. Don't get confused in between portal of exit or portal of entry. This concept is very clear for you. I'll make it as a story, then you will be able to understand. Okay. So this is the chain of infection and it is very, very important for you. Am I clear? Yes. Now we'll understand that, see, till now what we undergo, that we understood that what are the infectious, what are the agents that can cause infection, how are the clinical features that is visible in a person who is infected. Yes. Then what are the different terms we understood, that is your either pathogenicity or the virulence. Okay, or pathogenesis, we understood how the means what are the different stages of infection, how it is causing you infection, that also we studied. We understood also what is the chain of infection. Yes. Now we will see that what are the, हमने suppose देख ली infection. Now we have to understand that how are the measures we gonna take to prevent such infection. What are the different measures that should be taken as a protocol to prevent infection? So infection control protocols. Okay, the main part is infection control protocol. So different protocols are there. Okay, different infection, different protocols are there that will be helping you to take certain measures to prevent infection. First and most common infection control protocol, which is the very important for every step, is hand hygiene. Is your hand hygiene very, very important. Question sometimes asks that what is the main protocol or the basic protocol which can be taken to prevent infection or to take control over the infection? That is a hand hygiene. You need to take proper steps. Okay, different hand hygiene steps are there, different hand hygiene measures are there that should be taken to prevent infection. So each and every, see, listen, each and every control we will study in detail, so don't worry. So hand hygiene also we'll be taking in the next part. This is a complete series. Okay, we'll also understanding each, and for hand hygiene I'll take a separate class for you all. In the next class maybe I'll be teaching you about all the things about hand hygiene, what are the movements, what are the steps which you have to do. Okay, so now we are just seeing that what are the protocols, then each protocol will be seeing step by step. Okay, then what are the next thing you can do? Yes. Okay. Yes. What are the next thing we can do? What next thing means as a prevention you can take vaccinations. Yes. Proper PPE kit should be worn by the healthcare workers. PPE kit means personal protective equipments. Okay, that will be helping you to prevent infections. What are the PPE? What are the components of PPE? We will study that in a separate class. Okay, that will be a complete class for you. Each the protocols I'll be taking a separate class for you all. This is not over yet, so don't worry. I'm just telling you now about the protocols. What are the protocols? So that now after that we'll be studying each protocols in details. Okay, then PPP, in PP what are the components? Mask, okay, then your gown, okay, and goggles, then cap, then your shoe caps. Okay, so whatever all these things are your different PPE materials which will be helping you to prevent infection. Yes, after that, proper disposal of the waste. Proper disposal of the waste means that is also waste disposal. So that if you are disposing your waste somewhere, so you have to see that you are disposing it in a proper manner, so that it won't be again a mode for infection for some other rodents or your flies or your mosquitoes. Okay, then waste disposal. We'll also be studying about waste disposal in a particular separate class. Yes, then last but not the least is your environmental factors. Environmental factor means we have to take proper measures to maintain all the sanitary protocols in our environment. Proper food handling method should be checked. You have to avoid maintaining the stagnant waters. Okay, then mosquito repellent should be used so that they won't be able to spread further infections. Okay, especially in your rainy season. Yes, then every corner of the house or an environment should be cleaned. Okay, pesticides and insecticides should be properly means they have to be spread in a regular manner. You need to check your saplings and all. So this is the environmental factors. Okay, so these are your certain measures which you can take to control infection or to prevent further spread of infection. So in our next class, we'll be studying each of these measures separately and in a detailed manner. Okay. So I hope today's we are pausing it over here today. Okay. So in the next class, we'll be studying about hand hygiene. How are we gonna take proper hand hygiene measures so that it will be served as the proper basic in a sterile way to prevent the infection. Okay, I hope the class was helpful for you all. Any doubts you're having, mention all your doubts in the comment section. Don't forget to like, share, and subscribe ENE channel. Okay, your subscriptions or your like gives us the motivation to provide you more informational and important classes. Okay, thank you and have a good day.